And so it's another classic example of how we're treating the symptom but not getting to the cause. And then unfortunately the treatment is causing more problems because now H. pylori, for example, is actually, that's the bacteria that's in the gut, and it's not all bad, but too much of it is definitely bad. Welcome to the True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell, stress, inflammation, and functional health clinician.
And I'm your co-host, Brigitte Spurgeon, metabolism and nutrition expert.
This podcast is where we bring hope, truth, and inspiration for your holistic health journey.
Because the world needs the best version of you.
All right, so we're back here with episode 2 of our GI series. And I want to start off reading a quote. Actually, let me go through a little bit of a case study, and then this medical doctor had an encounter with a patient, and then ultimately led him to give a quote that I absolutely love. But this is a neurosurgeon, and he was called in on a case for a 30-year-old female who had presented to the ER, and that female had partial paralysis from severe degenerative disc disease because her spine had just collapsed from osteoporosis, which no one could understand why. They called him into the to put him on the healthcare team because obviously her nervous system was compromised with her spine collapsing. But nobody could figure out what it was. There was no warning signs or no history consistent with osteoporosis. She literally just started to collapse on herself. And so ultimately, when this neurosurgeon, who's now a very famous neurosurgeon, decided to think outside the medical box, he actually just started to look at her history and her nutrition and just started to ask questions outside of what they typically would talk about. And he found out that her whole entire life, all she'd eaten was things like processed foods, tons of grains, carbohydrates. Her hormones were actually part of her health history, were significantly imbalanced. She had low to no vitamin D levels in her blood. And ultimately, he realized that lifestyle and gut health and nutrition was way more impactful with someone's health and could do something crazy. Like even in a 30-year-old cause her spine to start to dissolve. So he kind of got serious about that. So he took it upon himself now to learn, smart guy, started to learn about the microbiome, learn about the gut. And he decided to work with her on that, just doing the basic things. And sure enough, she ended up making a full recovery and living a, respectable quality of life in spite of the fact that just years before, she was losing her spine. And if you've been with us for more than 5 minutes, you know that we're pretty passionate about how healthy that spine and nervous system is. But ultimately, he led to something that I love. And this quote and that case study and reading about that neurosurgeon is what led me to start to do a lot of gut stuff, whatever it is now, a decade ago, and be really passionate about it and just say, if we're going to impact people with their health, then we better not only be experts when it comes to the nervous system and the spine, but we better be experts when it comes to the gut. And sure enough, here's the quote. And he says here, health is going to be revolutionized by the science that is uncovered in the brain-gut axis over the next few decades, which we're now halfway through that few decades that he said. I believe the diseases that currently have no cure or known cause will be tied to this axis eventually. Diseases like ALS, MS, lupus, rheumatoid arthritis, autism, depression, Crohn's disease, Parkinson's, and Alzheimer's, just to name a few. So we're talking about here's a top Harvard-trained medical doctor, well-known neurosurgeon, and he basically abandoned the medical way of thinking and dove right into the natural way of thinking, focusing on the brain-gut axis. And of course, now he has millions of followers from all over the world that have gotten amazing results, similar to our patients here in the office. So anyway, having said that, when we disrupt the microbiome, and talk about the brain-gut axis here real quick, your favorite nerve, our favorite nerve, and a super popular nerve inside the human body is that vagus nerve. And a lot of people have heard of the vagus nerve. But what people don't realize is that it's and we had to look up the anatomy before. It's the lower portion of the vagus nerve actually is really intimately connected with with communicating between the microbiome and the brain function itself. And so when we see things like when I got stressed, I felt it in my stomach, right? Or when my stomach was upset from something that I ate, it gave me a headache, right? It's so there's this intimate connection between the brain and the gut and along this axis, and it's the vagus nerve that is deeply impacted by the microbiome being shifted in or out of balance, and it affects brain function. And so that's why there's also such a deep correlation between anxiety and depression. And like we talked about on the last episode with serotonin, right? If you're not producing proper amounts of serotonin, and if your microbiome's off, and therefore disrupting the communication, from through the vagus nerve to your brain, then you're really set up for failure in the category of any neurotransmitter related illnesses or problems like anxiety, depression, even brain fog and focus issues, ADHD in children, etc. So huge, implications here when it comes to making sure that that gut's healthy.
Yeah. Wow. That story is so impactful. I remember when first hearing you share that case study. And, I just think of, the patients that I work with on a daily basis. When they come to see me, I would say 25% of them have that similar lifestyle. They have been eating processed foods, chemical laden foods, a lot of carbohydrates, their whole lives. So, like, that's really scary that in our day and age, the way that our food supply is set up, the way that the cost of food is, the way that the grocery stores are set up, that actually describes a
Mhm.
large percentage of people. And to see at just 30 years old, her body literally was just giving up on her, it was starting to crumble. So that's very sad. That actually grieves me. It makes me want to just run around and scream to everyone, like, please take care of your body, eat the right foods, eat whole foods, keep inflammation down, etc. But the other part of that is there's so much hope in that story, because just with learning about the microbiome, learning about the way that food impacts, and just making those changes, like the proper solution paradigm, that person was able to have a full recovery. So amen to the fact that the
Mhm.
body heals itself. The body has this amazing ability to heal itself if we do the
Absolutely.
right things.
Amen. Absolutely. Amen. And when we do that process fit, then leaky gut is the topic. We need to tackle that real quick and talk a little bit more about what that's about, because that's, again, everybody knows the name, few people understand what it is.
Exactly.
And the truth is and that would be more of how that patient ended up in such a devastating condition, right? And how so many people are dealing with autoimmune type illnesses, and because it may not even be full autoimmunity, it could just be autoimmune type symptomatology related to having leaky gut. Now, I will say this, for clarity: leaky gut, kind of more of a theory than anything. Gut permeability, very real. And so, for the purpose of this pod, we can talk leaky gut all day long, and it kind of has a broader umbrella, but gut permeability, very well, or I'm going to say better understood and accepted terminology within the medical community. And that's all that's talking about, is that those tight cells, as they're called, tight junctions, that actually hold your gut lining, your cells of your gut lining together, when they loosen for various reasons, for inflammatory reasons, for all the things that we talked about on the last episode, all the things that we do or don't do, and eating bad fats and eating sugars and all that, then that disrupts that tight junction. And so now partially digested foods, hard to digest foods, allergens, viruses, you name it, can now pass through that junction that was supposed to have been, that junction was supposed to guard from all that, so it can't get into the bloodstream. Now those things can, and then we have all kinds of problems. But then the main thing that happens there at the level of those junctions pulling apart is an immune response, right? So inflammation comes to the area because inflammation is fluid. Fluid has a bunch of immune cells in it, right? Wherever it is in the body. So now inflammation comes, brings the fluid, brings the immune cells, and we have inflammation like all over the place now, because now that's in the bloodstream from the gut. And so we have all kinds of white blood cells and such coming to the area ready to fight whatever it is that made its way through there. And that's how people end up with a lot of food allergies, is because they obviously, it would notify the bacteria or virus, but now it's starting to perceive partially digested food as the enemy. And so it starts to attack that. So we'll run food tests on people. We don't do it as much anymore, but we run a lot of food testing, and so we'll see foods that pop up, and they'll literally be triggering like all four of the IgG immune responses that you can possibly have every time they eat something. And that food could be absolutely could be gluten, it could be dairy, could be eggs, the most common, but also it could be things like black pepper and kale, right? It could be different vegetables. It just depends on whichever, whatever got through that intestinal permeability, and triggered that immune response. And so that's a little bit more about what leaky gut is, or gut permeability is. And so a lot of people then will say, okay, that sounds great, but like, and you mentioned some food testing, but how do I know if I have it? Well, one, we really just have to listen to the patient. I think world class histories comes to my mind. Taking a world class history from the patient is so important, because 80% of the diagnosis comes from that history. And if you go through all the different symptoms that are related to intestinal permeability, you can really get a good idea. But then a stool test is the gold standard for us in understanding how someone's overall GI health is. And our philosophy of definitely testing, not guessing, but also, I've heard this a decade ago, and I'll never stop saying it. But life is our quality of life is determined by the quality of questions that we ask. And so, if you ask better questions, which means doing a better test, then you'll get better answers, which means accurate clinical biomarkers related to the patient, so that you can take better action. So now you're actually looking at the cause and you're acting on the cause of the problems versus, trying to manage the symptoms, which are, our sick care system has certainly done a stellar job of kind of staying focused on the symptoms over the years. And so anyway, so that's just kind of that's what leaky gut permeability is. And that's our approach to it, is try to determine if there are any allergens, confirm that that's more of what it is, confirm if there's any allergens present, and then figure out, okay, where's the disruption happening? Because you could actually just take a bunch of stuff. Let me say this too. You could take a bunch of stuff to repair the tight junctions, because that's logical. And people would say, and that might be part of the protocol that we would use, but you still haven't answered the question, how did they get there? How do they get separated? What in my diet needs to change specifically for me, right? Because some people are going to have problems with certain foods that other people don't, et cetera, right? So it's a good consult conversation that happens there. But then we have to say, okay, and this is what shows up on our stool testing is, do you have pathological bacteria? Like I just had a patient yesterday, they have giardia, right? So obviously some water somewhere gave them giardia. Well, again, you can do a whole lot of different things, to try to help your gut. But if you don't get rid of the giardia, right, it's going to keep wrecking that gut lining. It's an infection that's going to keep inflaming that tissue. So, do you have any pathologies? That's number one, and they need to go immediately, right? And then you have your normal bacteria, of course. Do you have the appropriate amount of that normal bacteria in order to maintain healthy gut lining and mucosa, right? So that's important, because if you don't have those, then you can be at a deficit, leading to those tight junctions loosening up. And then there's opportunistic bacteria. And this is the bacteria that's not supposed to be there. It's not necessarily pathological, but we found it, and it's there for some reason. And the real incident with that is that there are some of them that actually can trigger autoimmune type responses and stuff like that. I should say that. But there are opportunistic bacteria that are just out competing. So for the when the food comes along, the prebiotics and the postbiotics, I guess, and all that comes along, then they'll consume, that material, so that your good bacteria doesn't have as much life-giving nutrition getting to it. And now again, you can see how the scales are shifting, out of balance, for your microbiome. So anyway, so that's like pages 1 and 2 of the stool test, where we just go through and we make sure, like, where are the bacteria? Are there any ones that are out competing other ones? Is there pathology present? And then once we kind of have an understanding of that, now we'll get into back to when we very first started the first episode, get into the anatomy, right? Like, just do you have inside the stomach itself, like, is there proper acid base balance? And I would say the high majority of the people that we test, I'm going to say in over 80%, I feel confident in that number, do not have enough acid in their stomach. So they're not even breaking the foods down the way that it's supposed to.
So,
And go ahead.
oh, I was just going to say, so I actually come into that quite a bit with patients, because one of the things that I'm an advocate of, I really believe, obviously, in the pH of the body has to be optimal so that it functions optimally. And obviously, to if you want your body to burn fat optimally, or if you want your immune system to function optimally, it's all about that pH balance. And so, coming from an unhealthy lifestyle, so many people, they're too acidic. So I like to use alkaline water in a very monitored and like very finite amount. I don't like for our patients to go over a liter of alkaline water, and it's mildly alkaline water, but it's just supportive as their bodies are healing. But one thing I always have to warn against is don't drink your alkaline water while you're eating because you don't want that alkaline water then to go neutralize the natural acid that your stomach is producing, that's what your stomach needs to digest the food properly. And you also need that acidity, even if you do have a opportunistic bacteria come in with your food, or something you're drinking. That acid plays a role in killing bacteria and viruses as well. Another thing that does it is like the antacids, or the medications that are designed to neutralize acid that come up for like acid reflux or something. But once again, we have to be careful that that's not going into our stomach when it's meant to be an acidic pH there, and then it's just neutralizing that acid.
Right. And so many people like they get reflux and then they want to shut down the acid, but the reality is that it's pathological bacteria or something else that's actually causing it. And so it's another classic example of how we're treating the symptom but not getting to the cause. And then unfortunately the treatment is causing more problems because now H. pylori, for example, is actually that's the bacteria that's in the gut, and it's not all bad, but too much of it is definitely bad. And so, but that's the bacteria that actually does two things. One, it actually affects the acid base balance, based off of our ingestion of certain foods. And then also, which if it goes out of control, people will know that H. pylori is what causes ulcers and things like that. But the other thing that it does is it affects the release of our satiety hormone, ghrelin, right? So that's certainly related to weight management and appetite and those types of things too. So it's really important to have the proper acid base balance, so that you're not suppressing the hunger, the satiety hormone, and so we overconsume that way, right? And so H. pylori really really important, when we're looking on a stool test. Then once we get to that point, is your pancreas producing the necessary enzymes in order to be able to break down the food? So this gets to be another frustrating thing for people, where they'll say I'm doing everything right, but then when you run a stool test, we want to see their enzymes maybe above 500, and I just looked at a lab earlier today, and the enzyme is less than 100. And again, a really frustrated patient when it came to their digestive system. But unfortunately, they're going to stay frustrated, and they could spend another $5,000 on supplements, and it's not going to make a difference if they're not restoring the enzymes necessary to be able to break the food down. And then there's biomarkers on there that tell us how's the liver functioning, how's the gallbladder functioning. Of course, that's super important for removing toxicity, and maintaining proper metabolics. And then we get into all the inflammatory markers, which again, we know inflammation being the underlying cause of 21st century disease. So to make sure that if the patient needs to be given something to help reduce inflammation specifically in the digestive system, then we'll handle that. Now, one of the coolest things that's on the new test that we've been using is a lot of people are like me, where you did take antibiotics. So they're less like you, more like me, because you're in the United States now, and that's what we do. So we take antibiotics for everything. And so we took a bunch of them, but now we can see there's actually a genetic part of the testing that actually tells us what is the genetic susceptibility of that particular antibiotic that I took as far as my microbiome is concerned. So, because some of us are genetically going to be predisposed for being more susceptible or less susceptible to different antibiotics that we take based off of our microbiome genetics. And so, which is really neat to see that, because and more for like just I guess answering questions. It's like, how did I get like this? Well, you took 17 rounds of tetracycline throughout your lifetime, and it turns out here that you're super susceptible to that, and so we're going to fix that now. And people, at the end of the day, when people are suffering from GI stuff, a lot of times that's not the most important thing to them. They just want to get it fixed because it's such a massive disruptor to their life. I mean, I'm remembering a story right now where there have been patients who have been having accidents in the car just getting to the office, if I'm being honest, right? Or that haven't been able to hold down a job until they could get a job that was within 10 steps of the bathroom. And then they hold on to that job, even if it's a terrible job for them. I remember, and it was a major stressor in their life, but it was the only job where they could get to the bathroom fast enough so that wasn't a major disruptor. So it's, so while we can answer some questions as far as like how did we get here, mainly we just want to see the current state of things. Again, ask those good questions, and then just build a program to get us away from all those digestive issues. So
That reminded me of a story when I was working clinically on the chiropractic side with patient intake. And I remember actually, and this was in a couple of cases, but I remember a patient coming in with severe Crohn's disease, and they were just so their whole life is disrupted by this, and they had just been put on this medication. I believe it was like a monthly or a bi-monthly shot, and it was very, very expensive drug. And so we took cervical x-rays, we did full intake cervical x-rays, and it was one of the worst C1 angles that I've ever seen clinically. And which I don't know, Dr. Bagwell, do you want to speak about that, just pertaining to the vagus nerve and the connection to the gut? Because I remember having, the patients like, I don't understand why you're looking at my cervical spine when, I can't hold anything in my GI. So could you maybe explain that?
yeah, it just goes back to what we talked about earlier with the vagus nerve actually comes out of the upper cervical area. And so that's why we would look so high in the anatomy to determine if there's any interference. So when you have a misalignment in the spine, it causes interference with the nerves. In this case, we're trying to identify is there interference with nerves that are exiting or around the upper cervical area, and the vagus nerve drops all the way down to control digestion. It's actually the nerve, and I wasn't clear on this earlier, so I'll say it real quick. But the vagus nerve is the primary nerve for your parasympathetics, which is your body's ability to properly rest and heal, digest food properly. Here we are talking about that now, and just overall recovery. And so if you have subluxation or interference with the nerves at the upper cervical area, it can affect the vagus nerve, which leaves you stuck more in a sympathetic dominant state, which is fight flight, while your body's suppressed in its ability to digest foods and recover and heal.
Can I ask you one last question before we wrap up this episode? As a
Yeah.
question I also get a lot from our patients, and that is, so maybe they're having some kind of GI symptom, whether it be constipation or diarrhea or bloating, something like that, and they say, should I take a probiotic? Or they say,
Oh,
I take a probiotic, and it's one of those things.
yep.
Once again, get a lot, and I'm like, that is such a loaded question, because
Yeah.
once again, because the microbiome is so complex and everyone is so
Right.
unique and individual. So could you speak to that question for our listeners?
Yeah. No, yeah, super common question. I was a big fan. I've been a clinician while probiotics have become vogue, and so I've taken probiotics. I've recommended probiotics over the years. Now, what we understand to be more of the reality. So now that we're doing hundreds of tests, we can see the majority of people actually have dysbiosis or overgrowth of their bacteria. Okay, so number one, I've given out less probiotics in the last year than ever in history because we have a little bit of a different approach to that dysbiosis or overgrowth of bacteria. We want to knock it down, then eventually re-inoculate it, maybe with some good bacteria. There is something to be said for some specific strands. S. boulardii is one of them where that can really be helpful for people's health and not necessarily negatively impact overgrowth, or it can support healthy bacteria growth. But now we're getting into like custom recommendations, designer probiotics, right? Like now we're getting into which speaks more to the specificity and complexity of the microbiome. But I'm not a huge fan of just broad spectrum, 10 bazillion international units or parts per million or whatever, parts per billion of the probiotics. I'm not a huge fan of that anymore at all. That's my personal opinion. That's my clinical philosophy. But it's based on lots of lab work where we have to ask some better questions there so we can get to the cause of the problem and not just throw it. Now, a lot of people will feel symptomatically better. So a lot of functional medicine, even medical doctors, just give out probiotics like candy. because because again, they happen to be more symptom focused, but we're more cause focused. And so if we can just get proper, and here's another thing too, again, I go back to what I said, if you're not fixing the acid in your gut, if you're not having proper enzymes, if you're not killing off pathological bacteria, if you're not killing off yeast and parasites and all that stuff first, then it's at best, it's a temporary fix, if it's a fix at all. And really, it's just a Band-Aid, again, at best. So I'm not a huge fan. And another thing related to that question, and then we'll wrap up for today, is the consumption of things like kombucha and probiotic drinks, because now there's like 50 to choose from. If you walk into Whole Foods or even across the street at our common food, regular food stores locally here. And again, that's something that might be amazing for some people, and it might be symptomatic relief for some people. But based on testing, not necessarily like the nuclear dosing of our gut of all these strains of probiotics, it seems to be working against people's health more often than it's working for people's health. I'll just say that. But with testing, with talking history and doing proper testing, we would know more. It is a loaded question. That's like 4 episodes by itself, but we'll end it there for today.
Fantastic. Well, thank you for answering that. Hope all my patients are listening.
Yeah, right on. And that's going to wrap us up for episode 2 of our GI series. I'm sure we'll be back to this topic plenty of times in the future. But thank you again for joining us on True Health Solutions. Make sure that you click to subscribe so you get all the notifications for when we release our next episode. And that's all I have for today. Brigitte, you got anything else for our listeners?
Keep asking the right questions.
Thanks for joining us today on True Health Solutions podcast. Make sure that you click to subscribe. Also, go to our website, www.truehealthcharlotte.com, where you can download any resources related to today's show or any future shows. And lastly, if you search for True Health Center Group on Facebook, you'll be able to join our free health community. We look forward to seeing you there.